This is a supine technique I like to use to mobilize the upper cervical spine, either the OA joint or the AA joint, down to C1, C2. So again, it's a pretty non-assuming, non-threatening position. I don't have to do a lot of rotation. Again, we like to avoid rotation in the upper cervical spine with any manual techniques. It's also called a component technique. So what you're going to notice is I'm going to add a lot of different vectors in, which helps me lock down to the barrier without having, again, to go through this extreme of rotation side bending to get to the segment I want. So I'll show you on her left side since you have a better visual from there. So what I'm going to kind of do to set this up, I'll do OA first. I just kind of get her head out of the way. It doesn't sound very professional, but side bend her head a little bit, get out of the way, and then I'm going to basically roll her back onto my hand. So now I rotated her a little bit, I don't know, 30-ish degrees. A little bit of cervical rotation. In theory, from the osteopath I learned this from, Lori Hartman, you're rotating without side bending. So you kind of unside bent as you rotate. So think about some of the combined motions in the cervical spine. So now I have her rotated without side bending. I know there's a hole in that theory, but just go with it for a second. So she's rotated about 30 degrees. I'm going to give her a little bit of upper cervical spine extension, so a little bit of that chin out. From here, then I'm going to introduce a side bending in her upper cervical spine through her head. So now the axis is still through her ear, so now a side bending looks like that. I'm going to add some compression through her head, which sounds a little bit funny, but I'm going to give her head a little bit of a squeeze. I'm going to traction it towards my belly. So I have compression, traction, rotation, extension, side bending, and then I'm going to give her this almost a shearing motion. She's not locked out here, but it's going to be this shearing motion where I'm kind of taking her whole head and moving it towards my left foot while I'm maintaining compression, traction, extension, etc. So I'll put it all together and show you what that looks like. As a clinician, you should really feel like you're getting to that upper cervical spine without palpating it. If you practice on an educated patient that can give you feedback, they should say too they feel it spot on upper cervical spine. So again, get her head out of the way. I'm going to rotate her back onto my hand, about 30 degrees of extension. 30 degrees of rotation. Upper cervical extension here. I'm going to side bend her through her head, right through that, through her nose, so to speak, to get upper cervical. I'm going to compress. Now my two hands are literally going to squeeze her head. I don't want to be squeezing on her temple. I don't want to squeeze through her mandible, so I can stay up on the maxilla. Again, just don't be right in the temple. So sometimes I'll even come in like so. I'll give her head a squeeze between my hands. Get my traction, there's my side bend, there's the squeeze. I'm going to traction her towards my belly this way, and then I add this shearing motion towards my left foot, which will mobilize that left OA joint. So it's a beautiful technique, again, in a very non-threatening position. I don't have to lock the spine up because I've added these other vectors or components to it.